Cambodia has a population of around 16 million people. Situated in East Asia, it borders with Vietnam to the east, Laos to the northeast, and Thailand to the northwest. Its western edge sits, in part, along the Gulf of Thailand, providing helpful passage for trade and commerce. Inland, it features the Mekong River and Tonle Sap. Tonle Sap is a large lake that is home to many floating and stilted villages. Toileting facilities in homes result in waste washing into the water. Public health continues to be a concern, with many using the water that they live on to cook, fish, and clean their teeth. Fishing and farming characterises this area, with rice being one of Cambodia's many exports produced in its paddy fields. Throughout the year, there is little variation in temperature, with lows of 22 degrees Celsius and highs of 35 degrees Celsius. Rainfall varies across the seasons, with minimal fall throughout December to February and heavy downpours during September to October. Epidemics of dengue fever can occur after the wet season. This viral disease is transmitted by mosquitoes. Cambodia's biggest export, when measured in 2018, was clothing and accessories. Kodak, or Silk Island, is situated not far from the country's capital, Phnom Penh. It has a long history of silk weaving. Scarves and clothing are made using traditional wooden looms. Cambodia is famous for its temples complex, Angkor Wat, one of the largest religious sites in the world. The site originally stemmed from Hinduism and gradually transformed into Buddhism. Architecturally, Cambodia is heavily influenced by its colonial past and was under French rule from 1864 to 1953. The ruins of Angkor Wat, found after World War II, were restored by the French. Resourcefulness is a key feature of Khmer lifestyle. Small communities collect to specialise in the provision of food, clothing, or clay pots. The bamboo train, now identified more so as a tourist attraction, was at one time the Khmer's answer to needing a method to transport people and goods 7 kilometres. Each bamboo train consists of a 3-metre-long wooden frame covered in bamboo slats that rest on 2 pairs of metal wheels and axles. A fan belt, then connected to a gasoline engine, powers the platform. With only one train track, if a train going in one direction meets another heading in the opposite direction, the rule is that the platform with the least number of passengers must get off the track, remove their train, and allow the other passengers to pass through before they can be on their way. Religion. The official religion of Cambodia is Buddhism, with other minority religions including Hinduism, Islam, and Christianity. Buddhism is a cultural way of being in Cambodia and is pervasive in its cultural attitudes, values, and beliefs. Buddhism is characterised by 4 primary doctrines. This includes samsara, karma, nirvana, and moksha. Samsara is the belief of continuous cycles of rebirth. It is believed that the actions of the living will lead to a new existence after death. Nirvana, where insight and the extinction of desire liberates the individual from repeated birth and is the ultimate goal in Buddhist teaching. Culturally, death is related quite differently to Western cultures. Karma is the belief that there is cause and effect to our behaviour and that we can shape our future and bring good karma if we practice good intent and good deeds. Monks and nuns are dependent upon the giving of gifts or alms from individuals in the community. In return, they may offer blessings and/or generate religious merit. In the younger generations, active religious practice is less so than in previous generations. Buddhist monks in Cambodia are characterised by their bright orange robes, nuns by their white robes. Historical roots of Buddhism have meant that it influences education and healthcare. Being a young monk in Cambodia affords access to some of the best education that is offered in temples by elder monks. As a monk, you are well looked after. During the Cambodia Civil War, in 1968 to 1975, the Khmer Rouge forced disrobing of Buddhist monks, destruction of monasteries, and execution of uncooperative monks. In 1991, the Cambodian People's Party accepted Buddhism as its state religion, allowing it to flourish once again. The physical illnesses and healthcare needs of Cambodia. Cambodia does not have a national health service. People with financial means access private healthcare. There is a government system available to all people, but compared to the UK facilities, it is very limited and payment is required. Many rural Cambodians access treatment from traditional healers. As a consequence of the genocide in Cambodia's civil war, 1967 to 1975, the country has a relatively young population. Public health initiatives are in place to tackle preventable illness through immunisation, hygiene and health education. There is a high fertility and birth rate, with maternity and neonatal care requiring particular help to reduce avoidable morbidity and deaths in childbirth. As the Khmer population ages, adult diseases such as obesity, diabetes, hypertension and cancer are increasing in prevalence. Mental health has only recently been recognised as an illness that requires treatment. The country is only now starting to develop mental health services for children and young people. Cambodia is a country characterised by its climate. Humidity is high and mosquitoes are common, and so too is the spread of dengue fever. There is no immunisation, and treatment largely consists of intravenous fluids, monitoring and management of any secondary complications if the infection advances to affect the lungs. Much work is still required to support understanding of public health. Access to this information in an accessible format is needed to ensure its population and those that are not able to read develop understanding. In 2000, a survey completed by Cambodian Ministry of Youth, Education and Sport, together with UNESCO, estimated that only 37% of Cambodia's population are functionally literate. Oral hygiene, immunisation, spread of infection and infection control are all areas that will benefit from future public health initiatives. Cambodian Civil War. The Cambodian Civil War lasted over 7 years, starting in 1967 and ending in 1975. The Communist Party of Kampuchea, commonly known as the Khmer Rouge, led by Pol Pot with allies from the Democratic Republic of Vietnam and the Viet Cong, fought against the government forces of the Kingdom of Cambodia. The Khmer Rouge had control of Cambodia for 3 years, 8 months and 20 days between 1975 and 1979, and the civil war continued for over 20 years. After 1970, the Khmer Republic was supported by the United States and the Republic of Vietnam. Fighting and mass genocide at the hands of the Khmer Rouge led to their victory in April 1975. The civil war caused a refugee crisis, with 2 million people displaced, approximately 25% of the country's population. It is estimated that approximately 275,000 to 310,000 people were killed as a result of the war. Children were widely used during the war and trained to commit atrocities against target demographic groups that included the educated, journalists, Buddhist monks, ethnic minorities, and anyone who had not conformed to the Khmer Rouge in an attempt to purify the population. The educated included anyone that wore glasses and doctors, leading to the loss of an entire generation of medical professionals. Detention centres were established, with the most well-known being that of S21 Detention Centre that took over an old school in Phnom Penh, the country's capital. Here, people were processed, imprisoned and tortured. The detention centre is now the Tuol Sleng Genocide Museum. The rules of the original detention centre are still visible in the courtyard. Rules listed include: don't be fooled, for you are a chap who dare to thwart the revolution. While getting lashes or electrification, you must not cry at all. If you disobey any point of my regulations, you shall get either 10 lashes or 5 shocks of electric discharge. The Khmer Rouge forced disrobing of Buddhist monks, destruction of monasteries, and execution of uncooperative monks. If monks did not flee, they remained and practiced in secret. Post-Khmer Rouge, Buddhism was still suppressed. Cambodia is renowned for its killing fields and killing caves. Here, the location for the most significant number of killings occurred. Initially, people were lined up and killed with bullets to the back of the head. Over time, the Khmer Rouge realised the associated cost, and so instead hit people on the back of their head and ensured that they fell to their death at the bottom of a cave. Cambodian tourism is haunted by the photographs of cabinets full of human skulls and bones, with the remains of thousands amassed together. The fallout. Resources, people and physical. One of the most significant fallouts for Cambodia following the civil war has been the impact on its resources. With the Khmer Rouge aiming to destroy property and educated people, its medical infrastructure was crippled. Key pieces of equipment required to keep neonates, children and adults alive have had to be gradually developed and implemented over time. Battambang Bong Provincial Hospital has 1 ambulance. This is not to provide urgent medical care. People typically arrive in the back of a tuk-tuk, including those that are very sick. The people of Cambodia are, however, resourceful, and after visiting the UK and observing the equipment available, returned back and built oxygen canisters for use in intensive care. Adult breathing tubes are used on neonates to ensure that they can receive oxygen. The number of qualified medical professionals reduced substantially, and there is need for education and increased numbers of qualified staff. Trauma. The Cambodian Civil War tore through families throughout Cambodia, with fathers and sons fighting for different parties. Given the recency of the Civil War, the current generation have all likely directly been affected by the atrocities. Trauma and the impact on mental health is a significant health concern. This primarily displays itself in the high presentation of alcohol dependency. Treatment at present relies on detoxification and management of challenging behaviour. Individuals may therefore receive benzodiazepines and may be restrained for the safety of themselves and others. Talking therapies are not yet available in Battambang Bong or more rural communities. Mine victims. Cambodia is one of the most heavily mined areas in the world. The Cambodian Mine Action Centre estimate that the country is littered with approximately 4 to 6 million unexploded landmines after the Cambodian Civil War. It estimates that the country has approximately 40,000 amputees. Social care. The country's social care system is still being developed, with the biggest developments being made for orphan children. The country is heavily dependent upon non-profit organisations. There is still much work to be done to develop a system to support those individuals without a home or resources to look after themselves. Photograph 26 shows a picture of a man that does not have a home and is allowed to sleep on the grounds of the hospital for safety. If he did not, he would have nowhere else to go. Contemporary medicine, science and religion side by side. Khmer health is characterised by the belief that illness is not necessarily the result of one's physical or biological condition, but more as an indicator of one's position in the natural world. Overson and Tranquil, in 2010, explain how in the indigenous Khmer medical universe, the focus is on healing the social person rather than curing or healing the physical body. In the 13th century, people of Cambodia would attempt to cure themselves of leprosy and many other illnesses by entering water and washing their head repeatedly. Until French colonialism, Cambodia favoured a pluralistic approach, taking inspiration from Ayurveda practice. British colonial medicine then adopted a biomedical approach, and Cambodia in the early 20th century then attempted to restore Ayurveda to a fully scientific approach. Currently, there remains both indigenous and biomedical practitioners. Buddhist monks may engage in healing, commonly by performing preventative exorcisms to give spiritual protection. Cambodia is still developing people's perceptions of physical medicine, and education is required to increase awareness of its benefits. This is especially the case for more rural communities. An intravenous drip is often seen as a physical indicator that the hospital is delivering something helpful to an individual. In this way, the drip has become a powerful symbol. Once medication has been prescribed, it is a challenge to ensure that people will take it as advised and will return for follow-up treatment. Significant developments have been made in this area with the development of visual medicine bags, so that individuals that cannot read will be able to follow a medication regime. In Battambang Provincial Hospital, it is not uncommon to see science and religion coexisting in patient care. Many traditions can be observed around pregnancy and childbirth. Placing a thick woolen hat on the head of a newborn baby, along with a knife in its incubator, are thought to ward off any unwanted spirits. Similarly, placing the tooth of a deceased loved one around the neck of a child, worn as an amulet, is thought to keep any evil spirits away and keep the child safe. For the first week, and sometimes longer, after childbirth, the mother can commonly observe a practice called roasting. Here, the mother is wrapped in layers of blankets and clothes and lays over a fire. This is thought to restore balance and prevent postpartum illness. A photograph later on shows an attempt at public health regarding this practice. Medical care and public health in rural areas is generally via health centres staffed by nurses and midwives. They offer a first point of contact for all, including immunisations, a very basic pharmacy, baby checks, contraception, and a full maternity service. They refer on to main hospitals very unwell patients, but usually there is no ambulance service. Health education is an important part of the role. Basic blood tests can be done and sent to the central hospital for analysis. Tests are also sometimes done by local private pharmacists as a first port of call for patients. Unfortunately, often this causes confusion, as the results are poorly interpreted by pharmacists and patients alike. Patients can be quite accepting of Western medicine. Indeed, often they request intervention and treatment for self-limiting conditions. Antibiotic resistance is consequently high. Disability. As in any other country of the world, Cambodia has a disabled population that has specific health, social, and welfare needs. Much of the disability found in Cambodia in children are congenital and include encephalitis, cleft lip and palate, and learning disabilities. Much fewer disabilities are acquired through road traffic accidents, as these tend to be fatal, owing to lesser use of helmets on mopeds and motorbikes, and also minimal emergency services. Typically, ambulances are not used as emergency response vehicles. Treatment of cleft, lip and palate is not routine, and surgery is typically not available outside of Phnom Penh, the country's capital. Here, families may be able to receive input from a charitable organisation, or very few may be able to pay for the surgery privately. For those that are not able to access this, the child is left with significant complications, difficulties with eating, hygiene, and infection. Children with disabilities in Cambodia are typically visible in the community up until the age of around 7 to 10 years old. Parents of children will normally expect grandparents to take up the care role as they leave small rural communities to find work, sometimes leaving the country, working in Vietnam and sending money back for parents and children. Grandparents are frequently seen carrying children with disabilities, as there are few equipment services that provide wheelchairs and hoists. Provision for management and rehabilitation of disability and learning disability is limited, and one recent development within Battambang Provincial Hospital has been the installation of a sensory room to assist with this. future. In 2011, with the help of a grant from the British government, a small delegation from North Tees and Hartlepool NHS Foundation Trust, made up of the Chief Executive, Director of Nursing, Medical Director and Consultant Physician, visited Battambang Provincial Hospital in Cambodia. The hospital serves a population of around 1 million people. The aim was to see if there was mutual benefit in establishing a link between the hospitals and the School of Health and Social Care at the University of Teesside. Working with Cambodian colleague Dr. Kaksila, the director of Battambang Provincial Hospital, and with the support of the local government, it was decided to formalise a link through the creation of a charity initially based in Teesside named Transform Healthcare Cambodia. The charity has now expanded and has a second base in Lancashire. The aim of the charity is to relieve sickness and to promote and protect good health for the benefit of the public, in particular, but not exclusively within the Battambang province, through the provision of training to healthcare workers, education on the prevention of diseases and hygiene, the provision of equipment and financial support for such other healthcare-related services as resources permit. The whole focus is on working with and being guided by Khmer colleagues to improve training of staff and quality of healthcare. The charity has funded key Khmer staff from Battambang Hospital to visit hospitals and community services in the UK. This has included particular emphasis on maternity and child health, cardiology, mental health services and management, to name but a few. In November 2018, a joint project was implemented with a charity called Sick Kids to install a sensory room accompanied by staff training within Battambang Provincial Hospital. Dr. Sivleep is the hospital lead for the development of mental health services and oversees the daily use of the sensory room to assess children with developmental needs and to offer play therapy to develop basic skills. Teams of volunteers from Transform Healthcare travel to Cambodia 3 times a year. Directors of the charity and volunteers raise their own funds for the work. Written reflections from those travelling from the UK show the value of working overseas within a different culture and system. Invariably, all return with praise for the commitment of Cambodian colleagues and also a much deeper appreciation of our own National Health Service. After almost 9 years of working together, Cambodian healthcare staff have become good colleagues and friends to many others in the UK. The work continues.